Thank you very much, Dr. Chin. I'm Jennifer Fassbender, Director of Program Initiatives at Reinvestment Fund, which is a nonprofit financial institution using capital analytics and expertise to build healthy and more equitable communities. And as an exercise physiologist by training, of course, I'm a major fan of the standing ovation and the physical activity breaks. So thank you so much, Jim, for all your help with that. And with that, we have my co-chair, David, and our speakers, Dr. Chin and Dr. Simon, for some Q&A.
And we'll only have time for a couple of questions since we've run over a little bit, and we have one final wrap-up session to go. Maybe while Jennifer's getting
We've got power. All right, great. So my first question is for Dr. Simon. You mentioned and emphasized provider training as being so critical and important. And so I'm thinking about maybe what you might recommend as some of the recommended formats that might help to move that forward, because that is an important issue in reducing bias.
Formats, role play, things like having medical students or health professional students or fellows or residents, clinical trainees take implicit association tests. I mean, something simple. Having frank, open discussions. Infusing health equity in every single curricula. You see that now. Medical schools has changed and has health equity elements or health disparities training elements throughout, but making it more intentional, even more repetitive. Sometimes I get a lot of pushback from medical students when I give a health equity lecture, and they say, well, we already had this one lecture. And then I push back and go, well, how many lectures on cardiovascular physiology have you had? And what's going to be more useful when you're in this room with this particular patient, with this particular issue, and you've addressed it 10 billion times, and you are at the top of your patient's level and trying to figure out how to get this patient to listen to you from your perspective. And there's a pause in the room, and you know, we move on, and they listen to my lecture. But again, it's trying to change that culture. That's really, really important. And leadership matters, too. When you've got deans and presidents of universities and provosts and department chairs that are all on the same page, then we can talk. And then that's really an issue today that it needs to be addressed actively.
Great, thank you.
We have a question from the
Audience question?
Sure, thank you. This is for Dr. Melissa. Thanks for your presentation, by the way. You had mentioned during your presentation the importance of design, which is very crucial indeed. And I was just wondering, what would you say to a sort of a new design or maybe an embedded design that sort of bring caregiver as an inclusive, collaborative partner in this world of healthcare system, be it embedded with EHR, electronic health records, or as a continuum care for patients, making it patient-driven, centered. You know, because it's so often we sort of don't take the importance of caregiving as important as we should. But I think in this instance, they should be part of the collaborative efforts in rendering care.
Thank you for the question. Absolutely, I agree that caregivers or significant others or partners should be included. Also, this is a particular issue for cultures and groups that integrate family and need family to be at the table with the decision. So we need to be informed as care provider team how to best integrate that. That hasn't. There's some studies that show how to do that in certain issues like palliative medicine and oncology care, but across the board, there's less of that. In obstetrics care, we have group care that allows you to bring your partner or friend or support person with you to your care visits, but that is within the context of group prenatal care, which is not a standard of care across the United States, nor has it showed to actually improve outcomes in every single thing we're interested in obstetrics. So we still have a long way to go in terms of practice and integration.
Thanks for your response.
We have another question from the audience.
My name is Bob Griss with the Institute of Social Medicine and Community Health. The whole day has focused on so many different issues. I'm convinced that everything matters. But I don't hear an integrative infrastructure that requires any systematic way of identifying health equity issues and allocating resources to them. And I think that community health planning is the solution to, is the linkage that's missing from the whole day and from all of the presentations. And I would like to remind us that community health planning has a history. And there were infrastructures developed during that history in the 1960s and 1970s. And they had things like community health planning boards. They had certificate of need concepts where the community got together and looked at resources and looked at needs and identified the disparities and made recommendations. They didn't have any power. They made recommendations to political leaders to allocate resources to address the disparities in an efficient, effective, and equitable way. That's what a system is. When Marcia identifies 1,000 factors up there and uses a word like design, I don't see design. I see the absence of design. Design requires an accountability system. It requires government. We all see how healthcare policy issues are being discussed in the media now as one of the most crucial issues coming up in the 2020 election. But you don't hear any discussion of the advantages of a system around resource allocation in an efficient, effective, and equitable way. Mm-hmm. I think that we are missing the boat when we spend our time counting problems, identifying all sorts of symptoms of those problems, and saying leadership matters. Yeah, but so does democracy matter. So does community engagement matters. And we don't have an infrastructure requiring accountability.
Mm-hmm. Thank you for your remarks. We have to conclude. And the design question is a huge one, and that by itself is a whole different workshop. Right. But with that, I just want to, Marshall, did you want to say?
I was going to see if more, yeah.
I would say it boils down to, your comments boil down to 2 points. One is that, you remember my slide that said that we don't have explicit policies that support and incentivize equity. It's just what you just said, design those policies, having accountability, and then adequate funding. I would add, though, that regardless of whether you have a conservative or a liberal administration, there are things you can do no matter the political tone of the environment. There's interesting things that can be done in a very much a free market approach, interesting things that can be done in a more regulatory approach, and things that combine the two. So I think that it can be done in any type of administration. The second point is that to get to the point, though, that people care about it, and this is possible, that's the whole point about, we need to talk about our values. That is a moral issue. We need to work on the communication and the messaging. We need to be more vocal with what we believe in our hearts. And I think, again, I think we just need more of that.
Great, thank you. Well, that concludes our fourth session today. Thank you to all of the speakers and everybody who helped to prepare this workshop. Thank you to everybody. Another round of applause for... Thank you very much.